This video is all about the medical condition asthma. Asthma is an allergic reaction in the lungs caused by external stimuli like pet hair, dust or pollen. The airways become inflamed, which makes it difficult to breathe. The signs and symptoms of an asthma attack are difficulty in breathing, especially on exhalation. Their breathing will make a wheezy sound on the out-breath. Tightness in the chest, anxiety because it's not nice if you're struggling to breathe. They won't be able to speak in full sentences. And cyanosis, which is a blue tinge on the lips and other extremities. The treatment for asthma as a first aider is to sit them down and lean them forward slightly. Assist them to use their inhaler. Consider using a spacer if they have one. Encourage slow and deep breathing so as to minimise the risk of hyperventilation. If there is no improvement after 2 minutes, then get them to take their inhaler. Call 999 if the attack is not relieved after 5 minutes or 10 puffs on the inhaler. There are lots of different colours of inhalers. In an emergency, it is the blue inhaler that will relieve an asthma attack. Most asthma attacks will be relieved with rest and the use of an inhaler, but asthma can be life-threatening in some circumstances. At this point, it is worth mentioning hyperventilation. This is different from an asthma attack, but sometimes gets mistaken for it. It usually occurs due to anxiety or a panic attack. Hyperventilation is noticeable by the patient taking very deep and fast breaths. The air goes in and out easily without noise. They are breathing so fast that it can cause signs and symptoms like dizziness, pins and needles, and even cramps in the fingers. If someone hyperventilates for too long, they may even pass out. Hyperventilation is not a medical condition, so will resolve with time. The best action we can take is to be reassuring, remove anything that may be causing the person stress, if at all possible, and coach their breathing. Attempt to regulate their breathing to a normal rate and depth, and then the symptoms will disappear. There is a lot of advice on the Mind website about anxiety attacks if you want to do some further reading. So to recap, if someone is struggling to breathe due to asthma, then sit them down comfortably and get them to take their blue inhaler. If there is no improvements after 5 minutes, then call 999. Thank you for listening. I hope you found this helpful.